All right, thank you all very much for joining our December Information Exchange meeting, the last one for this year. Before we start, I'll quickly run through our ground rules, which I will share now on my screen. So I really appreciate it if everyone mutes their microphone when not speaking, so we have a good sound when speakers are presenting their information. Please do respect each other's views and opinion, and do not say or do anything that makes you uncomfortable. Also, if you, we will have quick, very short questions and answer sessions after each speaker. If you have any outstanding questions, please do feel free to send those to me on my email, which I will share on my on the chat box as well, and I'll pass these on to the speakers. Hopefully, you'll get the answers for your outstanding questions. You can use the reactions button at the bottom of your screens to raise hand if you have questions, and feel free to put anything in the chat box as well. Okay, so this is the start of the meeting. We have very interesting topics today. I'm very grateful for all the speakers who joined the meeting today. They'll be providing very important updates and information on what to do if you feel unwell over Christmas and New Year, and how the local health and care services can help you. I'll let each speaker introduce themselves, so we can save time for more questions and answers. The first topic will be self-care and out-of-hours GP during Christmas and festives and New Year. And our first speaker is Anna Hambury from Clinical Commissioning Group. Over to you, Anna. Thank you.
Hi, thank you. Yes, my name's Anna Hambury. I am the urgent care lead for City and Hackney within NEL CCG. And so today I've come to talk to you really just about things you can do and what's available to you if you're feeling unwell over the Christmas period, and particularly focusing on GP and primary care. But in actual fact, I'm actually going to start a little bit before that and talk to you about other things you can do before you might even need to see your GP. And so one of those things, and that's where the item self-care comes from. So this is just really for me a chance to say that there are lots of things that you can manage yourself at home. And in terms of the Christmas period coming up, we'd like to encourage you to make sure that your medicine cabinet has got all the kind of over-the-counter medicines that you might need. So things like paracetamol and ibuprofen, the painkillers, anything for cuts and grazes, sore throats, and obviously something like things to help with indigestion if we're all going to be eating slightly differently and doing slightly less over Christmas. So that's one thing you can do, is make sure your medicine cabinet has got lots of supplies in it. Then two other key things that I want to highlight in terms of looking after yourself is, if you take any repeat medications from your doctor, please get your request for repeat medications in today, ideally, or as early as possible next week, so that you make sure you've got plenty of those over the Christmas period. It doesn't mean to say that things won't be open, but it's much better to have to be prepared so that you don't need to go and get those. And the other thing about looking after yourself, I suppose, is a plea, and there'll be a presentation in relation to this later on in the session, and that is by taking up all the vaccines that you are entitled to, or that are appropriate for you and whatever health conditions you have. Clearly, obviously important is COVID at the moment, including the booster, but then there's flu as well, and some of you will be eligible for shingles vaccination. So please look after yourself and take those up. Then after self-care, I wanted to highlight another really important place where we can go for medical help, and that is to our pharmacy, because the pharmacists that work in there are specialist trained. They know a huge amount about medicines, and they don't just hand out prescriptions or dispense prescriptions, but they also can give really valuable advice and care for minor illnesses like coughs and colds, and stomach problems, rashes, and some aches and pains. And of course, some pharmacists have special rooms where you can get that advice, and you don't need to go. You don't necessarily need an appointment. And often pharmacies are open later on into the evening than other services. So it really is something that I would encourage you to think about, whether they might be able to help. If they don't think they can help and they think you need to see someone else, then they will probably also know where best to go to get further help. So that's another thing: self-care, and then your pharmacy. I know we've also got a presentation following on that note with more detail about pharmacies as well. After that, I would say if you've got an urgent healthcare or a health worry or a concern, then your GP really should be your first point of contact. And when your obviously when your GP is open, there will be same day appointments available on the day for them to try and see you if you think you've got an urgent health need. Those appointments you can book either by calling your GP, or you can book those online. I know that a lot of people there have been lots of changes in the way that we provide our care recently since the pandemic began, and so some people aren't 100% sure what's being provided where. So GPs are providing care in a few different ways. They're doing things on the telephone, they're doing things online with something called e-consult, but they are 100%, I want to confirm, that they are seeing people face to face for those people who need to be seen. So I just want to make sure that everyone knows that, because I think sometimes people have been a bit confused as to whether GPs will be seeing you. They may start with a telephone and then see you face to face, but yeah, if you do need to be seen face to face, then they will make arrangements to do that. I would say that if you can use an online route, so an e-consult for non-urgent questions, then that's helpful, because it means that then the urgent cases can be dealt with in another way, or also those people who don't have access to online. I talked about your GP being your first point of call for when they are open. So your GP practice routine opening times is 8 in the morning till 6:30 at night, Monday to Friday. But in actual fact, you can book an appointment to see a GP. It might not necessarily be in your practice, in evenings up until at least 8 o'clock at night, so from 6:30 till 8 in the evenings in the weekdays, but also 8 in the morning till 8 at night as a minimum on the weekend as well. And you can book those appointments through the same way, calling your GP or online. In City and Hackney, we're very lucky. We have a special system in place called the duty doctor, and that is where practices have agreed that if you think you need to be seen that day by your GP and they are open, then even if there aren't any appointments they can give you on the phone at 8 in the morning when you get through, then they will take your details and the duty doctor will call you back in that day. He or she will speak to you about what the problem is, and if they think that you need to be seen and there's absolutely no way they can fit you in, then they'll know exactly what to do and they'll help you make arrangements. So I guess that's one thing that we are very lucky to have in City and Hackney. So if you think, oh, I need to be seen by my GP today, but they're not going to have any appointments left, please do call your practice, because they should be able to put you on the duty doctor list and someone will call you back the same day to work out what best to do. And your GP really is the best person to know what is the best thing to manage whatever it is that you're worried about. So obviously we're talking about the holiday period, and I'm talking a lot around normal opening hours, etc. GP practices will be open in their normal times, but will be closed on bank holidays. The only time that there might be some difference in that is if your surgery is normally open on a weekend, but the weekend is one of the special days, so it's not a bank holiday, but Christmas Day is a Saturday, and your practice is normally open on a Saturday, it might not be open. So I would say the overarching message is that GP practices are open over Christmas, but they are closed on the bank holiday. But please do check your practice website to confirm that, because there are a few tiny differences between practices, especially if your practice normally opens at a weekend, because some of them do. And then the other thing I wanted to say is that even if your GP practice closed, there are actually GPs working in lots of different places when your GP practice is closed 24 hours a day, 7 days a week. And so they are probably still the right person for you to try and see first. Now, because they are working in lots of different places, it's really complicated for us to try and explain where they are. So the best way to access them is via 111. So it's quite a simple message that if you have an urgent problem and you don't think that you can wait until your GP opens again, but you think you might need to see a GP, then phone 111. 111 will take you through some questions. You might speak to a GP on the phone in 111, but they know where everyone is working and where all the appointments are, and they will be able to make arrangements for you to be seen by a GP somewhere else in the system who is working when your GP practice is closed. So, key message from me: if your GP practice is open, and we've talked about when they are open, then they're your first port of call. If they're closed and you have an urgent but not an emergency problem, you don't need to go to A&E necessarily. You can call 111, tell them what's worrying you, and that they will be able to book you an appointment if necessary with a GP, or indeed if you need something more than a GP, they should be able to direct you, either tell you where to go or book you an appointment in the appropriate service. So that's really, in summary, the message from me over the Christmas period. Lots you can do in preparation at home. Pharmacy, don't forget them. GP, if your GP is open and they are seeing people that need to be seen. They're closed on bank holidays, but check your website. And if they are closed, there are other options other than going to A&E. And what you should do is call 111 or visit 111 online, and they will be able to advise you what to do next. So that's
Excellent.
really the summary from me around my section. I don't know if there are any questions at this stage. I will say that I will put all of that into a presentation which will be circulated afterwards, but welcome any questions now or indeed on my email.
Thank you very much, Anna. That's been really useful information. Just to let you know that this morning we've received a couple of questions that will be put in the chat box, depending on who is speaking and what the topic is. And one question we received, I think it's related to your presentation, is: are there home visits for housebound or older people during this period?
Absolutely, 100% always. And again, so those are, if your GP practice is open, then again, it's contact your GP. And if your GP thinks you need a visit, then they will visit you. If they're not open, then the same access through 111. And we have a service that does home visiting for us. So if they think you need to see a GP, but you're housebound and you can't get to where they are working, then they can arrange for you to have a home visit.
Excellent. Thank you very much. Any further questions for Anna? I can't see any hands raising. I guess no. I guess this was very explicit. Thank you very much, Anna. Thank you.
Oh,
so we'll move to our next speaker.
There's one.
Oh, sorry. I'm not
Cynthia.
seeing it because
Cynthia.
Hi, Cynthia. Hi. Go on.
Thank you very much. Just a quick one.
Yes.
I think I know the answer, but just to confirm, is telecare available at all times, regardless of whether it's a holiday at Christmas? And secondly, are there going to be arrangements to get vaccinations all over the holiday as well?
So in terms of telecare, yes, it's 365 days, a year, open 24/7. So that should be absolutely no change to that at all. In terms of COVID vaccinations, I am not sure that I am best placed to give the latest on it. And I know that there's a specific item later in the session, Cynthia. So I might defer to get that answered at that point.
Thank you.
All right.
Thank you.
Thank you very much. So if no further questions for Anna, we'll move to our next speaker.
Sorry, Canaria, Canaria, I can come in because
Yes.
I am the pillar lead for community pharmacy for the vaccination programme for London, as well as my other job. So
Okay.
I can give you some update around vaccination over the Christmas period.
Because we have it in the agenda, Jeremy.
I know, but what I'm saying is that
Sure.
that point was raised.
Of course, yeah, please.
So I can definitely update you. So yes, there will be vaccination, but pharmacies will be open to deliver vaccination over the Christmas period. Most pharmacies are open at various times, but there will be vaccination. But the key thing is to check on the National Booking Service to see which sites are open. Okay.
Excellent. Thank you, Jeremy. Thank you. Any more questions or comments? No? Okay, so we'll move to our second speaker, Jennifer Waterfield from the pharmacy team in North East London Clinical Commissioning Group. She will give very useful information on how to make the best use of our pharmacies, especially during this period. Over to you, Jennifer.
Thank you. Thanks. Hi, my name is Jen. It's good to be with you today. I've got some slides.
I'm opening them now.
Lovely, thank you so much. And so the information I'm going to give really builds on a lot of what Dr. Hambury was saying. I'm a pharmacist who works with practices, but I want to really highlight and recommend the good work that community pharmacists do and the services they have available to you. So this is a few slides about accessing medicines and making use of your community pharmacist on an ongoing basis, but specifically over the next couple of weeks. Okay, so how to order your repeat medicines. So Dr. Hambury mentioned to do that quickly in terms of the Christmas period, which is great. You can request your medicines in different ways. You can use your GP's online tool. You can call up your practice, or you can call your pharmacy. You might have one of those particular avenues that you use specifically. I just want to also highlight, it's not on this slide, that using the NHS app is a very easy and good way to do that. So please do use that if you haven't before. Have a look, ask someone to help you access that. And you might want to ask your GP about batch prescriptions if you are not already on them. That's something that might help you with the management of getting repeat medicines. A couple of key messages. I can see some black boxes on my screen. Can others see that as well, or is that just me covering some of the text?
Yes, there.
Oh.
Canaria, do you know if they could be moved?
No, let me try and share that again.
Otherwise, I can just carry on.
No, well, I'll try and share that again, Jennifer.
Okay.
Can you see the same again? Is that better?
I can't see anything at the moment.
Okay, that's very, oh, sorry, maybe because I wasn't sharing, sorry. How is that?
It's a bit better, yeah. Yes, that's fine. Brilliant. Okay, so you can still access medicines and appliances at this time. Just a couple of points. Do request your medicines. It could be 10 days in advance or any time up to that, but please don't request them before that, because we could run into issues with overprescribing and running out of medicines, but that will support the NHS if you do that. Next slide, please. Okay, and what can you do to help when you're ordering your medicines? I've mentioned just requesting no more than 10 days before, and then maybe not insisting on a particular brand of medicine. So some medicines, it's important that you always have the same brand, but most medicines, it doesn't matter. And for ease of supply and accessing your medicines, it's what is available in the pharmacy at that time. And we just ask you to be patient with your community pharmacists and your GP practices at this time. And please do not hesitate to ask your community pharmacy any questions you have around your medicines, minor ailments, or self-care. Canary, the slides have disappeared. Oh, yep, next slide. Okay, so just about getting your medicines this winter. So as you'll know, as everyone is, community pharmacists are busy with the pandemic and specifically the booster vaccination program just now. So if you are not self-isolating and you are able to collect your medicines from your pharmacy, please do this. If you are self-isolating or you can't leave the house, wherever possible, please ask help from relatives, friends, carers, or trusted neighbours as your first port of call to collect your medicines from the pharmacy and deliver them to you. However, if that support is not available from friends or family and you still have issues collecting your medicines, then do call your pharmacy and see if they can assist you. So community, yes, Canaria, somebody's just saying that there are black screens all over the, oh yeah, that's a little bit better. That's better, thank you. So yes, if you don't have one of those support options available to you, then do speak to your community pharmacy. Community pharmacists are not ordinarily required to deliver medicines. That does change if we're in a lockdown situation, but they may deliver them to you. So some pharmacies may deliver medicines to you. If you approach your pharmacy and they don't do that, then I would recommend you speak to another local community pharmacy because they may well do that. To avoid you phoning around lots of pharmacies to ask, you could maybe ask your GP practice who might know which local pharmacies deliver. Next slide, please. Thank you. So as Dr. Hambry was saying, I'd really recommend using these two sources of information for any minor ailments you might have over this period. So first of all, the NHS website, it has a lot of information about different conditions and how to manage self-limiting conditions, which is easy to read, very accessible, easy to understand. So I'd recommend that. And there are also 3 other sources of trusted information there. If you're looking online, we can look at Google and it goes everywhere. I'm not quite sure what's accurate or not, but these 4 websites are really good sources of information. So I'd really recommend that. And also as a second point of advice, or information would be your community pharmacists. So they can recognise and treat minor conditions, they can give advice, recommend medicines, recommend what you could buy over the counter to relieve symptoms. And as Dr. Hambry said, they are also then able to signpost to other health professionals if that is necessary. They are open often in the evenings, at weekends and close by you. So do make use of that source of information. Next slide. Thank you. Yes, now again, Dr. Hambry mentioned this, and this just gives a bit more detail. So it's a really good idea to stock up on some of your OTC medicines for the winter period. There is a web link there which gives you this list of some specific medicines that might be helpful to have at home to treat some minor ailments. So there's a list there covering allergy medicines, antidiarrheal medication, heartburn, indigestion, etc. And then it also recommends that you have a first aid kit which would contain plasters, bandages and a thermometer. And then just a top tip around buying any of these items. If something is cheaper, it doesn't mean it's inferior. So if you buy Nurofen or Asda ibuprofen, they're exactly the same medicine inside there. And so you are much better to buy just the cheaper ibuprofen product. Is exactly the same and you will not waste your money. Next slide. Just wanted to highlight Health First Pharmacy, which is a scheme that City and Hackney pharmacies run. If you're unable to afford the cost of treatment for some minor conditions, then your pharmacist may be able to help you access that medicine via the NHS. So speak to your community pharmacy to see if you're eligible for that one. Next slide, please. This is a leaflet which will be available. You should be able to get that at your pharmacy or your GP practice or online. And here in the middle panel, it explains the eligibility. So it's not the same as for a prescription, it's a bit tighter. It's aimed for the socially vulnerable. And then to the right is a list of the conditions that are covered by Health First Pharmacy. So if you needed a medicine that would treat one of these conditions or treat symptoms, then you may be eligible to get that over the counter free. On the first panel on the left, it shows you how to register. So your GP practice may email the pharmacy, say, to confirm that you are a patient at that practice, or the community pharmacist might be able to check with some ID that you are at a local practice. Next slide, please. And then this is another new service I wanted to talk to you about, GP CPS, so GP Community Pharmacy Service. So I've just got some brief information here and another slide about how it benefits you, but do have a look online or speak to your pharmacy or GP practice for some more information. So some practices are up and running with this and others not yet, but will be soon. So when you call your GP practice, you'll be asked about your symptoms. If they indicate that you could be helped by a pharmacist, you will be offered a same-day private consultation with a community pharmacist. So why is this happening? So pharmacists are qualified healthcare professionals and they are the medicines experts. So they can offer clinical advice and over-the-counter medicines for minor illnesses and same-day consultations, which can be arranged quickly and at a time to suit you, which may not be available through a GP practice on a particular day. So what happens if after you call the GP practice, you are signposted down this route, the pharmacist will contact you to arrange your consultation on the same day or a time that suits you. And you may be seen in person in a private consulting room if the pharmacist thinks that's appropriate, or your consultation may be carried out over the phone or via video. If your initial call to the GP practice was about your child, then if they're 2 years or over, then they also can be seen by the pharmacist in this way. Next slide, thank you. So why would this be good for you? How could this benefit you? So as we've said before, community pharmacists are local, they're open longer hours than GP practices often. They can offer the same consultation outcome at a time that is more convenient to you. And then if the pharmacist thinks you need to see the GP, they can help and arrange an urgent appointment for you or signpost you somewhere else. So this scheme has been trialled other places throughout the UK, and feedback has been that patients have liked the convenience of having a consultation on the same day or a day that suited them at a pharmacy of their choice. And out of this sample group, 78% of people who had a consultation with a community pharmacist were successfully helped. So that meant they were given some advice or told about a medicine they could buy, or something happened which solved their problem without being referred back to the GP or to any other person. Next slide. There's just a slide here saying get your vaccines. I know someone's going to specifically talk about flu vaccines and about COVID vaccines, but just to highlight that you can access your flu vaccine, and if you're eligible, your pneumococcal vaccine at your local pharmacy. Just speak to them about that. And this is just the last slide, just to say that your local community pharmacies provide a range of other pharmacy services. So I've highlighted some, but they do provide other services. So do approach them, speak to them, and see what they have to offer you and how they can support you, especially during this period. Thank you. Are there any questions?
Thank you very much, Jennifer. Wonderful. Any questions for Jen so far? No. If we get any Jennifer, do you mind if I send those to you?
No,
And
that's fine.
respond. Excellent, perfect. Thank you
so
very much. Okay, so then we'll move to third and fourth. Oh, sorry, Cynthia, did you have a question? You were on mute, Cynthia.
It's half a question, half a comment.
Yeah.
There are many other services that community pharmacists offer, and I have experience of these, and they are indeed excellent. Have included in our case help with correcting medication mistakes made by a hospital. In other words, pointing out that what you've been prescribed conflicts with medications you're already taking, and they're able to take that issue up. Is a community pharmacist able to correct a medication, or do you have to go back through that service if they find there is an issue?
There is a new service that's just come out called a discharge medication service. So community pharmacists will just in routine practice be checking what someone has been prescribed in hospital and looking at the current medications. But this is a kind of enhanced service to allow medicines reconciliation, which some practices have started doing and working with Homerton Hospital on that, which is fantastic. But to specifically answer your question, Cynthia, if a medication was going to be changed, a pharmacist would first of all have a discussion with the GP just to check whether it is an existing medicine or one of the new medicines that needs to change, but they would have a discussion with your prescriber first, and they may have to go back to the specialist care or the hospital, or they may just do that with the GP. So it would be a process, but it could be sorted quite quickly, especially with this enhanced service.
Thank you very much. Thank you.
Excellent, thank you. So we'll move to our next topic, which is the vaccination, flu and COVID vaccination. We have two other great speakers as well, and I'll let them introduce themselves quickly. Katie and Ben from the Clinical Commissioning Group. Over to you, Katie.
Hi everyone, I'm Katie. I'm the Communications Manager for City and Hackney at North East London CCG. And Ben, do you want to introduce yourself?
Hi there, I'm Ben Greenbury. I am the Programme Director for the COVID vaccination programme in City and Hackney.
And thank you all for joining once again. I'll quickly open your presentation.
Thank you. Can you remember to include the audio for the video
Yes.
as well? Thank you.
Do I have to do it again, or was it done?
Yeah, I think you will have to do it again. Yeah.
All right.
If the box is already ticked, then it should work.
Yes. Okay.
Perfect. Thank you.
Can everyone see this?
Yeah. I
Yes.
think so.
Okay.
Great. Okay, we'll make a start then. So Ben and I are just going to talk to you a little bit about why, how and where to get vaccinated in Hackney specifically this winter. So next slide, please. Sorry, oh, there we go. Oh, sorry, can we have that one back? Yeah, this is a nice picture of one of our Hackney residents actually being vaccinated, so we did want to include this one. So we'll start with what vaccines are available and eligibility for the vaccines. So we're going to talk to you specifically about the COVID-19 vaccine and booster, and about the flu vaccine and about eligibility for those. As we kind of, oh, I'm sorry, I think we're getting the black boxes again. Oh, they've gone. Sorry, yes, so we're going to talk about eligibility for those two vaccines. Those are kind of what we bundle in under winter vaccinations, although as Anna mentioned, there is also a shingles vaccination, and there are of course other immunisations and vaccines available through the year, but we will be talking about COVID and flu. So can we move to the next slide, please? Okay, so we'll start with the COVID vaccine. So as I'm sure many of you will already know now, this is administered in 2 doses several weeks apart, and there is a 3rd dose which is now available, and we refer to that one as the booster jab. So at the moment, everyone in the UK aged 16 and over is eligible for their initial and 2nd doses if they have not yet received them, and all children aged 12 to 15 will be offered a 1st dose of the vaccine. And you can get a booster dose if you've had a 2nd dose of the vaccine at least 3 months ago and you're over the age of 18. So the offer has recently been expanded to include more or less everyone who's had their first 2 doses and is 3 months past that point now. So we are really kind of pushing and encouraging people to take up the offer of their booster jab if they haven't already. So next slide, please, just to speak to the booster jab a little bit more. So why a booster jab? So research suggests that the protection provided by vaccines does decrease gradually over time, but more urgently, what we are now seeing is that with the new Omicron variant, 2 doses simply doesn't provide enough protection against this strain. So we do really need people to have their booster jabs in order to provide the most protection and efficacy against the new variant. We are seeing a rapid increase in the number of COVID cases across the country, including an uptick in hospital admissions. And so we just need to take action now, really, and kind of get as many people vaccinated as quickly as possible, as you will have all heard from our recent Prime Minister announcement. Next slide, please. And so then the flu vaccine, I've put the eligibility for the flu vaccine on this slide here. It's also worth noting that you can, of course, pay to have the flu vaccine done as well if you're not eligible for a free vaccine on the NHS and you wish to take one. And so that's available through pharmacies across the country. As Jen kind of mentioned, pharmacies are kind of the primary way of receiving your flu vaccine. But in a moment, Ben will be talking about how and where you can get your COVID and booster jabs in Hackney as well. But firstly, we're just going to talk a little bit more about why you should get vaccinated. So next slide, please. Back to our lovely Hackney lady. Here we go. Okay, so to start with, I'm going to show you a video from Dr. Abdul Patan. He is one of our GPs in Hackney, and he has spoken a little bit about the importance of winter vaccinations. He does talk about the flu jab a little bit more specifically to just explain why that's still kind of necessary and important in the context of COVID. I know a lot of people are kind of more concerned about COVID, understandably, but he explains why it's actually really important to get the flu jab as well if you're eligible. So we'll watch that, and then we'll just kind of talk a tiny bit more about the COVID vaccine as well, and how the impact that we've seen that having on our NHS and how it can help to protect the NHS over the winter. So if you could play that video for me, thank you.
Yeah. I'll start it, and if you don't hear it, just let me know.
Thanks.
Hello, my name is Dr. Abdul Patan, and I'm Hackney GP.
Oh, sorry. Try to make the screen bigger. That didn't work. So leave it as it is.
Hello, my name is Dr. Abdul Patan, and I'm Hackney GP. Today I would like to remind patients and residents of Hackney about the winter vaccination program. Now, in the winter, COVID-19 viruses and flu viruses tend to spread easily and quickly. This is because it's colder, and of course we are staying more indoors with our friends and family. If you are invited for a vaccine, I'd urge you to take up the offer and protect yourself, your family members and others from the COVID-19 infection. By taking the vaccine, the pressure the NHS and GP practices like mine will be reduced, and we will be able to use our resources to help patients with other health conditions. I'm going to talk to you a little bit about the flu jab. If you were to get the COVID-19 infection with the flu infection, that can result in serious consequences. It could mean hospitalization, and the combination of the two viruses could often be fatal. This is because the COVID-19 virus and the flu vaccines are easily transmissible and very quickly spread. If you've had COVID-19, it's still safe to have the flu vaccine. It will still be effective at achieving and helping to prevent the flu. Finally, I would like to finish off with just a reminder of hand, face and space. Remember to wash your hands regularly for more than 20 seconds. Remember to wear a face covering in crowded places and enclosed spaces. Remember social distancing where possible. Stay safe this winter in Hackney.
Thank you. Yeah, so that's one of our GPs talking a little bit about the importance of winter vaccinations and the flu jab more specifically. So, I mean, as he kind of said in that video there, you know, GP practices like his are really kind of helped by the population taking up the vaccination offers that are made available to them as much as possible. So we've got a slide here just a little bit more about how the vaccines are helping to protect the NHS. So we have seen the link between hospitalisation and death significantly weakened by the COVID-19 vaccine. And it is also worth saying, this wasn't actually in the video, but if you've already had COVID as well, then you should still take up the offer of having a vaccination. Having had it alone doesn't give you strong enough immunity against being reinfected by it. And also, you know, the vaccines themselves, you know, you can still contract COVID once you've been vaccinated. It's just that your chances of being hospitalised or dying from the infection are significantly reduced. So it's just really important to kind of think about that when you're thinking about how you best want to safeguard your health and that of your loved ones around you over the Christmas period. We don't know enough about the severity of the new Omicron variant at this stage, but we do know that it is highly transmissible. So therefore, you know, if we do see the majority of people infected with it this winter, regardless of the severity of it, just through sheer numbers, we will see a significant increase in the number of hospitalizations and deaths if a large enough percentage of the population contract it. And we don't want to be in the position of having to cancel planned surgery and other procedures due to staff shortages or a shortage of available hospital beds, which we know has happened previously when rates have been really high. So it's kind of really important in terms of safeguarding your access to healthcare for other conditions that you might have. You know, we want to make sure that that the NHS is available to support you as best as possible over the winter period with other health conditions apart from COVID. That's still so important to us. So by being vaccinated, you'll help increase our chances of being able to do that as effectively as we can. So I think it's now over to Ben to talk a little bit about where you can get vaccinated in Hackney. So next slide, please, and I will mute myself. Thank you.
Thanks, Katie. Yeah, so this slide, as Katie mentioned, is about where you can get vaccinated in City and Hackney. And I think first thing to say is our NHS colleagues and community pharmacists are doing a truly amazing job of kind of keeping our sites open and vaccinating thousands of people a week within City and Hackney. So in terms of where the offer is available, we have 10 community pharmacies in Hackney which are offering the vaccine. And as Jeremy alluded to just before, lots of those are open over the bank holiday weekend and doing longer hours beyond kind of the typical 9 to 6 as well. We've got 2 times local vaccination sites. So these are the larger sites, so John Scott and Bocking Street, which I believe many of you are probably aware of by now. We also have St Leonard's Hospital, which is offering a clinic between 3 and 5 days a week, depending on capacity. And I think the important thing here to say is that for all information on the sites, there's lots of information available on the Hackney Council website. In terms of booking an appointment, the best way, as Jeremy mentioned, was to go onto the NHS National Booking System website or by calling 111 to book in your appointment. We are also offering walk-ins at a number of sites. So for that, you can either go on to NHS Grab a Jab Finder and it will kind of come up. If you put in your postcode, for example, it will tell you where the closest ones are that you can come for a walk-in, or there are kind of a number of community pharmacies that are offering walk-ins but aren't publicised on the website. So that may be a matter of kind of going past the pharmacy and they may have more information there. Next slide, please. Which vaccine will I get offered? So this is for the within the system. We have Pfizer and Moderna at the moment, and kind of you can be offered either or, depending on different sites. So our local vaccination centres have Pfizer and Moderna will be coming on board, and our community pharmacies are offering a mix between Pfizer and Moderna at their sites. This means your booster dose may be different from the vaccine you had for your first and second dose, but please don't be alarmed by that. Some people may be offered a booster dose of Oxford AstraZeneca if they cannot have the Pfizer or Moderna vaccine, but those are kind of few and far between and in extenuated circumstances. Next slide, please. So this slide is really just to say that as part of the COVID vaccination programme, we're working alongside specific community groups within Hackney to increase uptake, and we understand that these groups best understand the different community needs. So what we're really making sure is that we're equipping those groups with all of the kind of relevant information so that they can kind of speak directly with their communities, answer any questions, and also signpost them to where to get the vaccination, where to find out kind of more information where relevant. And I suppose the visualization there just shows kind of the breadth of kind of where these community groups work across. So kind of different geographies, but also working with different demographics, whether that's kind of you've got kind of Shomra in the north working with the Haredi Jewish community, or you've got Can working with the African communities. We've got a breadth of organisations that really hopefully support our residents in the way that they need. That's all from me. Thank you.
Thank you. So we've also, sorry, I've got there were 2 slides left, sorry.
Oh, sorry.
Ben was handing back to me.
Okay, all right. So,
it's very quick. Yeah. So
yeah, thank you.
Just 2 more things. So the first was just a reminder on testing. So this is a reminder to please not turn up at your GP practice or an emergency department if you have any COVID symptoms, unless you've taken a negative PCR test. So just another reminder on the differences between tests. So lateral flow tests are supposed to be taken if you don't have any symptoms. Everyone should be taking these at least twice a week as set out in government guidance. You can get these by ordering them online, and you can also collect them from your pharmacy. I know that there has been a shortage in recent days, but we're hoping that will be remedied very soon. And so if you do have any symptoms, then a lateral flow test isn't appropriate, and you should immediately self-isolate and take a PCR test. And so a quick refresher on symptoms as well: a dry persistent cough, a fever, a change to your sense of taste or smell. And we've included, if you're worried about any other new symptoms, we are seeing that feedback and research is suggesting at this stage that the new Omicron variant, the symptoms are more kind of like fatigue, a headache, cold-like symptoms. So that can include a runny nose. So really, if you have any cold or flu-like symptoms, you should take a PCR test to be on the safe side, and you should be isolating from that point. And also to please wear a face covering. This is obviously now in the guidance to be done more generally in shops and on transport and things, but especially in GP practices and hospital settings, any kind of medical setting, please do wear a face covering. And then finally, I've just kind of linked the landing page here. So this is where we're redirecting everyone here for all information about winter vaccinations, including COVID and flu. In North East London. So that also includes FAQs, which will cover things that we've not had a chance to talk about here because we've kind of done a bit of a whistle-stop tour, but that will include things like side effects from the vaccines, information on what's in the vaccines, and other questions that you might have, as well as the ability to book appointments for both the COVID and booster and flu vaccines. So yes, I'll drop that link in the chat as well. Thank you very much, everyone, and we're happy to take any questions.
Thank you very much.
So we'll try and get one for you.
Okay, thank you very much, Katie. Just to ask Jeremy and Riza, would you mind if we take another question before we come to you? I know we only have 10 minutes to go. Thank you.
Yeah,
Cynthia, thank you. Cynthia, I can see you raise your hand. Do you want to go ahead?
Thank you very much indeed. A question about the names of the vaccines. I have just read that Moderna's name has been changed to Spikevax, and I wonder what that might mean for people who are familiar with certain names and then get faced with another one that might increase hesitancy or mistrust that this isn't the real thing. Is there any guidance available on that? And secondly, the presentations did not include places where city residents can get vaccinations. And I'm concerned that the information being offered is principally, sometimes only through websites, and 3/4 of our older people's reference group members do not have IT access. So A, where do city people go for vaccines? And 2, have you got alternative sources of information for people who don't have IT access? And 3, are there big name changes we need to be made aware of so we don't refuse a thing called Spikevax?
Thank you. Thank you, Cynthia. Katie or Ben?
Yeah, I was going to say, Ben, do you know about the Moderna changing the name? Because that's the first I've heard of that.
I was hoping someone from the pharmacy team is probably best placed to answer.
Jeremy. Yes, Jeremy, would you mind?
It's no different to Pfizer, and I think it's probably just a bit of a communication thing. It's a branding name.
Kanira.
Who is talking? I can't see who is talking. Someone is calling my name.
I can mute then. It's Rosalia. I'll do that. Don't worry.
Thank you. Yes, Rosalia NT. Rosalia, did you have anything to say on that? No. Okay. And sorry, I just lost connection. I can see Shirley raise her hand. Shirley, very quickly, if you don't mind, if that's okay.
Yes. I think it's really strange that you emphasize hugely the huge importance of testing right at the very end, and nothing about testing, where you get the lateral flow test, where you get the PCR test. No information about that at all. It's absolutely crucial. And I mean, I regard myself as reasonably well informed, but actually, if I think about it, I don't know the answers to those questions. I went by a stall getting off the bus the other day where they were giving out these blue boxes, and I don't know if that's a lateral flow or PCR. And yeah, okay. So, but where do you get the PCR test if you need it?
Yeah, I can drop a link in the chat about testing availability for getting a PCR. There are walk-in sites available. Ideally, you are supposed to book online, but I think there is alternative provision for people who don't have IT access. I know that's a point that was just raised. And with regards to accessing vaccines in the city, my understanding was this was a Hackney focused meeting, which is why I omitted that. So I'm really sorry for that. Again, I can drop a link in the chat with information about the city. But yeah, and that's kind of all I can offer there.
Yes, thank you. Thank you very much.
Maria,
yes.
I think Rosalia was trying to answer some of those questions, but I don't know if her sound was working.
She told me before the meeting that she may have some internet issues as well. And
okay.
she's off the meeting now.
Okay. Yeah.
But any further updates will yes, Lola?
Yes. Thank you. I think it's important that the message about the change of name be spread, because this morning I had my booster and I thought I was having Moderna. It was written on the board that was what it was. And then after having my booster, I was given this piece of paper and I was reading it thinking, what was Spike Vax? And I was a little bit worried. So I was given Spike Vax, but not Moderna. So this is the first I've heard about it as well. And that was really worrying. So if it's an issue, I think it's key that that message is sent across to everyone so people are aware when they go in for their booster, there's a name change.
Yeah, originally the vaccines have just been called by who made them, but over time then they will get actual names. But yes, that's a good point, needs to be communicated as well.
Thank you, Lola. And yes, Katie, thank you for sending this link for vaccine information for city residents. You're right, the meeting was about it was made from Health Watch Hackney. It was about Hackney residents and services in Hackney. I know that many services are, provided in city and in Hackney together, but this was specifically for Hackney residents. So, but here is the information, and I'll make sure I share this in the post-event information when it goes out. Did you have any more questions, Cynthia?
Yes, my second one wasn't answered. I take the point about this being about Hackney, but this point still applies because the last speaker said if you want more information about vaccines, where to get them, all the rest of it, and this is the website. No other way, and City and Hackney, certainly most of the Hackney residents I'm responsible for at OPRG don't have online access. Where do they go for information? We need an alternative, please. If you could put that in the chat as well, it will be appreciated.
Thank you. That's a good point as well. I
think there are hard copies of leaflets with information that can be picked up from GP practices and from pharmacies as well. I think that the advice, if you don't have online access, is to speak to your pharmacist or your GP, and they'll ensure that you have all of the information that you need, and they'll try and find a way to make it accessible for you as well.
if you could put that in the chat, because I'm taking notes to circulate to our members. Yeah. Thank you very much.
Excellent. Thank you very much, Cynthia. And I appreciate we only have 4 minutes for the usual finish time, but we still have one very important topic to cover. I'll give the word to Jeremy Wellman and Reza from the Reza, yes. And I'll let you introduce yourself. That will be easier. Thank you.
Okay, so quickly, because I'm aware of time. So my name's Jeremy Warman, so I'm head of primary care commissioning, which covers dental, optom and pharmacy for the London region. So we look after the whole of London. I'm just going to very briefly cover what the position is in terms of accessing dental services over the Christmas period. It's the same as it's always been in recent years. So all practices generally will have an answer phone message over that period, which will direct patients in various ways in terms of how they can access the surgery. But also in most cases, there is the default position in London, which is 111. And anyone who's in urgent dental pain, if they are in urgent dental pain, they ring NHS 111, and they are then directed to the dental nurse triage service, which operates right across London. And there the patient's needs will be assessed. And if a patient needs treatment, they will be directed to one of the urgent dental care centres that are operating in London over the bank holiday and the weekend period during the Christmas period. Obviously we have them working at different hours over the period. I think it's worth pointing out, we have urgent dental care centres working through the week anyway, which is where we're at the moment because of the position we find ourselves in associated with the pandemic. But there are specific arrangements for the bank holidays and weekend periods. And we've got a dedicated group of practices which deliver urgent dental care to those patients that have been assessed as needing it. I'll leave it there because I'm aware of time, and I just thought I'll bring Reza in because he can talk about it, because he's a front-end dentist, so he can talk to you about how, what the position is from their point of view.
Thank you, Jeremy.
Thank you, Jeremy. My name is Reza Manbejud. I am general dental practitioner in City and Hackney. We have 2 dental practices in Stoke Newington, which providing urgent dental care, UDCH. This is generally, I am representing local dental committee, which is covering City and Hackney, Newham and Tower Hamlet. It is 28 NHS dental practices in the City and Hackney, which is 1 dental community service, and also Homerton Hospital, which providing a specialty. We have also dental services through IMOS, which is minor oral surgery, which they have a very short, what calls a waiting list. Also, in regard to the UDCH, this, as Jeremy explained, this service has been providing since COVID-19. It is available 7 days of a week and is going to be available in City and Hackney for Christmas or generally festival period. I think this is covering most of the time. The patient needs to just call 111. They would be triaged and then put one of the practices like a urgent dental care hub, and they can go and see the dentist. If you want more explanation about urgent dental care, I can give you more, because after COVID, it was a lot of backlog for the dentistry. We need to give all the credit to the Jeremy in regard to this service which provided by NHS England, particularly in London area. Without this service, we had a lot of problem. No patient getting access the same day after calling 111, and they seeing the dentist and they getting treatment. through this service, many of the children refer to the specialty services, like for children, and also for minor oral services and hospital services. I mean that it was great help, because we now concentrate a lot of through this UDCS services to the cancer people who has a risk of the cancer, and we can directly send, and they could be seen in 1 week or 2 weeks time in hospital.
So just to finish off, Canaria, just to say that Reza and his colleagues, as he said, have done a staggering job, frankly, because without the urgent dental care delivery, many patients would not be able to access any form of dental services because of all of the backlog that's been built up during the pandemic. So the delivery absolutely is, as Reza said, it's there 7 days a week anyway, but particularly over the bank holiday periods. And actually there's a good level of urgent care delivery in City and Hackney.
Thank you.
Particularly we sending people to a specialty service, like oral surgery directly. For example, I must be giving time appointment after 2 weeks, 3 weeks, maybe less now. Yeah, just we need to give all credit to Jeremy for this service, to be honest.
Thank you all very much, and thank you, Jeremy, for this as well. Cynthia, I can see you raised your hand. If we can have your question very quickly.
Thank you. This is about antibiotics. We have advised our members, according to what advice we read recently, I'd just like to know whether that's still in force. We read that we should not be begging our GP to prescribe antibiotics for things where they aren't really appropriate, but particularly because many are not working, and the short supply of those that are needed for people who are seriously ill and for dentistry, was the advice. Is that still the advice?
I think there's general advice, obviously, around antibiotic prescribing, but I think, again, as part of the urgent dental care provision, we also, in addition to the urgent dental care hubs, do have effectively what they call prescribing hubs. And yes, obviously, antibiotics are useful in dealing with dental pain, particularly if it's been triaged that actually it's an infection that is causing the problem. I can't obviously speak for the advice that's given out in general to medics and all the rest of it in terms of their prescribing habits and all the rest of it. I think there's a general obviously position around the use of antibiotics, full stop, which applies right across the board, not just to general practice, but obviously even within the realms of dentistry. Dentists will only prescribe antibiotics generally if they feel that they are actually what's needed. And that's obviously what you would expect all medical professionals to do.
I think I needed that when this is depend what type of need the patient has got, because it goes through triaging through 111. If patient has got a swelling or something like need antibiotic, they just directly prescribe antibiotic. If patient need to see the face-to-face, some of them need antibiotic, and most of them getting treatment, as I explained, for their pain. And also we send them, if they needed specialty services, we refer them to the specialty services. That's what we're doing.
Thank you very much, Reza. Any further questions for the speakers? I can't see anyone's hand raising. No. Oh, Cynthia, very quickly, really, that will be the last question.
Yes, I've had a friend who's had an allergic reaction to the booster jab. I'm not clear how widespread this might be, and we don't want to put off anybody from getting booster jabs, but what is the advice? How would allergic reactions, if they were serious, be recognized by a patient after a booster jab over the Christmas period, and what should they do?
I think so. It's not related to dentistry. I just leave it for others to respond this.
I think Rosalia can answer that question. She's just asked to be unmuted. Sorry to interrupt you.
No, that's Rosalia. Yes, Rosalia, you are unmuted now. Can you hear us?
She's frozen.
Okay.
Can you hear her? Do you want me to respond?
Rosalia, can you repeat that?
I think I've been unmuted. Can you hear me?
Yes, we can.
Hello.
We can. Hi,
Gosh.
we can hear you.
Apologies. You seem not to be able to hear me.
No, we can. We can hear you, Rosalia.
She can't hear us, I think.
Mm.
I think in fairness, yeah, because I think the key thing is I haven't been involved with the vaccination program myself in those circumstances. Then obviously
Can you hear me now?
it's breaking up, Rosalia. Then it's either a referral back to, depends where the vaccination was undertaken, but it would generally be a referral back to the GP, or in some cases, obviously, if a patient's under the care of the hospital, then it would be a referral back there, because obviously if there's been an allergic reaction to...
Okay, let me answer that question, even though I can't hear anyone else. So there is a trying to identify those who might be at risk of having allergy of the vaccines. So those who perhaps have a hitches in some of the vaccines. So where reaction, their GPs can facilitate a referral to. If, however, a patient has had the vaccine and has suffered an allergic reaction, usually all the sites have clear guidance about how to manage any allergic reactions or indeed any anaphylactic reactions. Depending on what the nature of the reaction, the patient might be sent to a hospital for further management or not. The patient's GP must be informed about any such reaction, and also the healthcare professionals and indeed the patient also can fill in what's called a yellow card report, which helps to collate all the reactions to all vaccines, not just the COVID vaccines, but all vaccines and indeed all medicines, so that there can be an overview of the number of reactions happening, the nature of them, and perhaps some of the background that might have led to such reactions. So in summary, that's about how to identify those who are at high risk of such allergic reactions and the management of it, and the very important need to report such reactions if they happen. So thank you. And oh no, I can't hear people, but I'm glad at least you can help me. And do let me know if you need me to expand on the Moderna Spikevax question as well, and I can do so too. But just to assure everyone, allergic reactions are indeed very, very rare. Initially, there were a couple of incidents that happened, which was why everyone wanted to be on the safe side, and some guidelines came in about patients waiting after vaccinations. But allergic reactions to these vaccines are indeed very rare.
Thank you very much, Rosalia.
The other thing very quickly worth adding to that is that allergic reactions shouldn't be conflated with having severe side effects. And that all patients, when they receive their booster jab, are given a leaflet explaining.
Was that okay?
I know she can't hear me. That all patients, when they receive their booster jab, they are given a detailed leaflet explaining which side effects are common, which are less common, which are incredibly rare. They can identify side effects, and there are also instructions within that to report to the yellow card scheme, as Rosalia just said, but also what they should do if they need to seek medical treatment because they're suffering from severe side effects. So just to add that.
Okay, thank you. I hope all the questions were answered. But again, I left my email in the chat box. Please feel free to send me any of your outstanding questions. We ran over time. I'm really sorry, and thank you very much for being online. That will be the end of the meeting. Thank you to all the speakers for joining today. Really appreciate it. All the information you shared will be shared with City and Hackney residents, I would say, as we have information about City as well. And I wish you have a very good, well-deserved festive break. And we'll start with new powers in the new year. Thank you all very much. Have a good afternoon, and I'll speak to you again. Thank you.
Have a nice Christmas all.
Thank you, everyone.
Bye.
Bye-bye.
Bye.
Thank you.